Welcome to the deep dive. We take a stack of information articles, research, our own notes, and really trying to pull out the most important nuggets of knowledge, giving you a shortcut to getting up to speed. Today, we're diving into a disease that, well, it might sound a bit obscure at first, but it actually has a surprisingly significant impact, not just on animal health, but potentially, on our dinner plates too. We're talking about bovine listeriosis. You might have heard it called circling disease or maybe silage sickness.
That's right. It's a bacterial infection, primarily hits ruminants,
Yeah.
like cattle. And it's mainly caused by this really tough little bug called Listeria monocytogenes. And it's serious stuff. We're talking severe neurological disease, reproductive failures, devastating abortions, and sometimes even widespread blood poisoning, septicemia.
Wow.
Yeah, and if it's not caught and treated, the mortality rates are incredibly high. Even survivors often end up with permanent damage.
And here's the bit that really connects it to, well, to your world, listening in. This disease is zoonotic,
Exactly, zoonotic.
meaning it can actually jump from animals to humans, primarily, I understand, through contaminated food.
That's the main route, yes. So, while our focus today is cattle, the ripples can definitely spread far beyond the farm. Our mission here, with all this info we've gathered, is to unpack it all, help you understand the complex journey of this bacterium.
Okay, so this circling disease, silage sickness, what exactly is it, biologically speaking? Break it down for us.
Okay. So, at its core, bovine listeriosis is what we call a sporadic bacterial infection. When it does hit, the most common form, especially in adult animals, is inflammation of the brain and its membranes. Vets call it encephalitis or meningoencephalitis.
Right.
Now, while we often see these isolated sporadic cases, it's really important to get that outbreaks can happen, especially if, say, a whole group of animals gets exposed to one heavily contaminated source, like a bad batch of silage. That's a classic example.
Okay, so it's not usually cow to cow.
Not typically, no. The critical distinction here is that it's usually not spread directly animal to animal. It's more about widespread exposure from the environment. And like I said, if you don't treat it early and aggressively with antibiotics,
Yeah.
the mortality rates are, well, they're remarkably high.
Okay, so we know the disease picture. Let's dive into the culprit itself, Listeria monocytogenes. What makes this bacterium tick?
Well, it's incredibly resilient. It's what we call facultatively anaerobic,
Green.
meaning it can live, even thrive, with or without oxygen.
Yeah.
And it doesn't form spores, which actually makes it harder to eliminate from some environments. This little organism, it causes septicemia, neurological issues, reproductive problems across a whole bunch of different hosts. But for us and for you listening, the critical point is it's also a significant foodborne pathogen for humans.
Right. And what's really surprising, I found, is that Listeria monocytogenes isn't the only player. Other Listeria species can get involved too.
That's absolutely right. While L. monocytogenes is the main one, the one we hear about most, we do sometimes see others, like Listeria ivanovi. It accounts for maybe 10% of ruminant cases. And it seems to be more often linked specifically to those reproductive losses, the abortions.
Interesting.
But here's where it gets really fascinating and honestly adds a huge layer of complexity for anyone assessing risk. We're finding big variations in how virulent, basically, how potent or aggressive the different strains of L. monocytogenes actually are.
So not all Listeria are created equal, so to speak.
Exactly. Some recent studies even suggest that dairy farms might inadvertently be selecting for hypervirulent clones, strains that are just much more aggressive, and these hypervirulent strains can then potentially enter our food chain.
Wow. So just finding Listeria isn't the full story.
Not at all. It means simply detecting its presence isn't enough anymore. The specific virulence profile of that particular strain matters hugely, both for how sick the animal gets and for its potential to cause serious disease in people. It completely changes how you have to think about risk assessment.
Okay, so it's a highly adaptable, potentially supercharged bug. Where does something like Listeria even come from? How does it get everywhere?
It's actually astonishing how widespread Listeria monocytogenes is. You find it commonly in soil, on plants, in mud, water, sewage, decomposing plants. It's pretty much everywhere in the natural environment.
Just everywhere.
Pretty much. And its resilience is remarkable. It doesn't just thrive at room temp. It can actually replicate slowly, but it replicates even under refrigeration. We're talking just above freezing, like 0.5 degrees C, all the way up to 45 degrees C.
That's incredible. Fridge temperatures don't stop it.
Doesn't stop it, just slows it down. And it tolerates a huge pH range, too, from quite acidic, around 3.5, up to fairly alkaline, 9.6. Now, for cattle specifically, the most common infection sources, spoiled or poorly preserved silage, especially if the pH is too high.
What's too high for silage?
Ideally, silage pH should drop quickly below 4.5. Listeria really starts to thrive above pH 4.0, or certainly in that 5.0 to 5.5 range if fermentation isn't great. And even silage that looks okay can have these localized pockets, these high-risk areas, maybe where air got in and caused spoilage.
And it's not just silage, is it? I read it's naturally in the soil, meaning animals could pick it up even without eating silage.
That's spot on. It's naturally present in soil. So feeding silage isn't even required for exposure. And here's a really tricky part for control. Both animals, and humans too, can be asymptomatic carriers.
Meaning they carry it but don't get sick.
Exactly. They shed the pathogen in their feces without showing any signs of illness themselves. And this just continuously reintroduces it back into the farm environment. It creates this persistent cycle, makes complete eradication from a farm, well, exceptionally difficult. You need ongoing, really multifaceted strategies just to manage it.
Like the invisible roommate on the farm, always potentially there.
That's a good way to put it. Quietly doing its thing.
So, if it's everywhere, how does it actually get inside the cow to cause disease? What are the main routes?
The primary route, overwhelmingly, is ingestion. Eating contaminated feed, with that poorly fermented silage being the usual suspect. But there are other ways, less common. Inhalation, for instance, that can cause a kind of atypical pneumonia, sometimes seen in feedlot cattle, or even direct inoculation getting into broken skin or maybe into the eye.
Okay, but what about the neurological form, the circling disease? How does it get to the brain?
Ah, that's a fascinating and quite specific pathway. For the neurological form, Listeria often invades through tiny breaks in the lining of the mouth, the buccal membrane.
Breaks from what?
Could be from something as normal as teeth erupting, especially in younger animals, or maybe minor injuries from, say, dosing guns or coarse feed. Once it's inside that membrane, it takes this specific route. It travels up a major nerve in the head, the trigeminal nerve, directly to the brainstem.
Wow, straight up the nerve highway.
Pretty much. And this explains why younger animals, maybe 1 to 3 years old, are often affected. They're the ones actively erupting teeth, creating those little entry points.
That makes sense. So what are the triggers? What turns this background presence into a full-blown outbreak affecting multiple animals?
Again, #1 risk factor. Poorly fermented silage with that high pH. And like we said, sometimes you can't even see that it's spoiled, but the risk is there. Seasonality plays a role too. Outbreaks are definitely most frequent in winter when animals are usually being fed stored feeds like silage, and the neurological form specifically tends to peak in late winter or early spring.
Are there other stress factors that make animals more susceptible?
Yes, absolutely. Predisposing stress factors are important. Things like poor nutrition, sudden changes in weather, especially cold, wet conditions, the stress of late pregnancy or giving birth, transportation stress, even things like flooding, overcrowding, or just generally unsanitary conditions.
So if we connect all that, it sounds like outbreaks aren't just bad luck.
Not at all. Outbreaks really result from this complex interplay. You've got the bacterium's amazing environmental resilience, specific farm management choices, especially around silage, and then the host's own susceptibility. Age, teeth erupting, stress levels. It's this combination that can turn those sporadic, isolated cases into a herd-level problem, and that really highlights why you need a truly holistic approach to prevention.
And once an animal is exposed, how long before you see signs? Is it a long wait?
There often is, yes. For the brain form, the encephalitis, clinical signs typically show up maybe 3 to 4 weeks after they eat the contaminated stuff. But it can stretch out sometimes up to 7 weeks.
That long?
Yeah, and some sources even suggest a huge range, from as little as 16 hours to nearly 2 months. Human cases typically average around 21 days. But it's really crucial to stress. Asymptomatic carrying it without being sick, is way more common than actual clinical disease.
So most exposed animals probably don't get sick.
That seems to be the case. Now, in cattle that do get sick, the disease course is usually a bit less dramatic, maybe less acute than in sheep or goats. It might last 1 or 2 weeks, and spontaneous recovery can happen. But, and this is a big but, permanent damage to the central nervous system, the CNS, is a really frequent outcome in those that survive.
That long, variable incubation must make tracking it down tough.
It's a huge diagnostic challenge for you to consider. By the time you see the signs, that contaminated patch of feed might be long gone, finished. It makes traceback incredibly difficult. And it really underlines why being proactive about feed quality control is so important. You can't always react after the fact.
Right. So if listeriosis does take hold, what does it actually look like in cattle? You mentioned different forms.
Yes, it typically presents in one of 3 main ways in cattle: neurological, reproductive, or visceral. And it's actually pretty uncommon to see all three forms happening at the same time in one herd. The neurological form, the encephalitis or meningoencephalitis we talked about, that's definitely the most common and the most recognized form in adult ruminants.
Okay, for someone listening, maybe a vet student or a farmer, what are the really classic telltale signs of that neurological form they should look out for?
Good question. The really classic signs are often unilateral.
Meaning just on one side.
Exactly, affecting just one side of the animal. And that's a direct result of the infection damaging the brainstem on one side. So you might see general signs like depression, disorientation, maybe a fever, loss of appetite, drop in milk yield. But the more specific things are uncoordination, taxia stumbling, and then the hallmark sign, the one that gives it the name circling disease, continuous circling, often toward the affected side.
It's always circling one way.
Often, yeah. And you usually see a noticeable head tilt along with that.
Sure.
Sometimes other compulsive behaviors like pressing their head into corners or against walls.
Okay. What about the face?
Key diagnostic features there. Unilateral facial paralysis is common. So you might see a drooping ear, a dilated nostril, a lowered eyelid, maybe the muzzle deviated to one side, a slack, flaccid lip, but just on one side. This paralysis leads to other signs like excessive drooling, difficulty swallowing, dysphagia, or sometimes they pack food in their cheek because they can't move it properly.
Wow.
We call that quitting.
Quitting, right.
And then in the terminal stages, sadly, you often see generalized paralysis and the animal goes down, becomes recumbent.
Those unilateral signs sound really distinctive, very helpful for suspicion. But I guess vets still have to rule out other nasty things.
Wait, absolutely critical.
Right.
While those signs are highly suggestive of listeriosis, you have to rigorously rule out other serious neurological conditions. Number one on the list is always rabies because of the public health risk, but also things like poliencephalomalacia or T-mid thromboembolic meningoencephalitis. It just hammers home why you absolutely need that definitive lab confirmation, even if you strongly suspect listeriosis based on the signs. You can't assume.
Makes sense. Okay, beyond the brain issues, you mentioned a hidden threat, the reproductive problems. Tell us more about that side of it.
Right, the reproductive form. It's often a hidden threat because it can cause abortions, stillbirths, and deaths in newborn calves, typically in the last trimester of pregnancy. And here's the really tricky part for herd managers. These abortions can happen without the mother cow showing any prior clinical signs of illness herself.
Wow, so she seems fine, but loses the calf.
Exactly. It makes it a really silent drain on productivity, very hard to spot early on. And remember, Listeria ivanovi, that species seems to be more frequently linked with these reproductive losses. Abortion rates in an outbreak situation can get quite high, sometimes up to 20%.
20%, that's huge. And then there's the third form, more acute, especially in young calves, the visceral form.
Yes, the visceral or septicemic form. This is most common in monogastrics animals with one stomach, but also in neonatal ruminants, very young calves. The thinking here is that in these young calves, their rumen isn't fully developed yet. It doesn't have the acidic environment of an adult rumen.
Ah, so the bacteria don't get killed off as easily.
Precisely. It allows the bacteria to essentially bypass that first line of defense and spread widely throughout the body via the bloodstream, causing septicemia or blood poisoning. It's systemic, not just localized in the brain like in adults. The signs are different too. You see acute depression, fever, loss of appetite, maybe coughing, difficulty breathing, diarrhea. And unfortunately, it often progresses very quickly to the animal collapsing, prostration, and death. If you were to do a post-mortem, you typically find focal damage, little spots of necrosis in the liver. That's the main lesion.
So brain, reproduction, widespread infection. Are there any other less common ways Listeria can manifest?
Yeah, there are a few others you might occasionally see. Mastitis, inflammation of the udder. Ocular problems, sometimes called silage eye or uveitis, which is inflammation inside the eye. Rarely endocarditis, which is inflammation of the heart lining. Gastroenteritis, and that atypical pneumonia we mentioned earlier from inhaling the bacteria. It's quite versatile, unfortunately. It really is. All right, so we understand what it is, how it spreads, what it looks like. Now, the crucial part. If listeriosis is suspected, how do we actually confirm it? What's the diagnostic process?
Well, the initial suspicion often comes from seeing those typical neurological signs we just discussed, or maybe a history of abortions in animals that are being fed silage. But, as we keep saying, because you have to rule out things like rabies, lab confirmation is absolutely essential for a definitive diagnosis.
What kind of samples do you need for the lab?
You need specific specimens. For the neurological form, brain tissue is best, particularly the brainstem. Cerebrospinal fluid, CSF, can also be useful. For reproductive cases, you'd want the aborted fetus itself, the placenta, maybe samples from the dam like vaginal swabs. For the septicemic form, liver and spleen are key tissues.
And what tests do they run in the lab?
Several things. Bacteriological culture is standard, trying to grow the Listeria from the sample. Often they use a technique called cold enrichment.
Cold enrichment. Yeah, it involves holding the sample at refrigerator temperatures for several weeks. Listeria grows slowly in the cold, while many other bacteria don't, so it helps selectively isolate it. Then there's PCR, polymerase chain reaction. It's a molecular test that's very sensitive and specific for detecting the bacteria's DNA, often targeting a specific virulence gene called ACE-ly. Histopathology is also really important, especially for brain tissue. That's looking at thinly sliced tissue under a microscope. Pathologists look for characteristic microabscesses and inflammation around blood vessels called perovascular cuffing in the brainstem. That's highly suggestive. And sometimes they use immunohistochemical stains, which use antibodies to specifically highlight the Listeria organisms within the tissue lesions.
Sounds like a comprehensive approach. Does the way Listeria behaves make diagnosis tricky sometimes?
It certainly can. A challenge for you to appreciate is its intracellular nature. It likes to live inside the host's cells. This can actually make it harder to culture successfully from certain tissues, even if it's there. That's why using multiple diagnostic methods, culture, PCR, histology, gives you the best chance of getting an accurate diagnosis.
Okay, so once you have that confirmed diagnosis, what's the battle plan? How do you treat it, and realistically, what are the chances?
Right, treatment. The absolute key here is early and aggressive antibiotic therapy. That's paramount for any chance of a favorable outcome and reducing mortality. You need high doses, especially for the neurological form, because you've got to get enough antibiotic across the blood-brain barrier to actually reach the infection site in the brainstem. And it usually needs to be a prolonged course of treatment to prevent relapses.
What antibiotics usually work?
Common choices include penicillin G, often high doses oxytetracycline, amoxicillin, sometimes others depending on the specific situation, and veterinarian's preference.
But I remember you mentioning a catch. Even if the bacteria are susceptible in the lab, treatment isn't always successful.
That's the frustrating part. While Listeria is generally susceptible to these common antibiotics in lab tests, in vitro, its tricky intracellular habitat hiding inside cells often limits how effective the treatment actually is in the animal, in vivo. That means that if treatment is delayed, even by a day or two after signs appear, the chances of success can become, well, pretty unrewarding, as some sources put it, despite using the right drug.
So timing is everything. What about supportive care?
Absolutely critical. You can't just rely on antibiotics. Supportive care is just as important, maybe even more so sometimes. This means things like providing good, safe housing, ensuring they get enough fluids and electrolytes, which might mean stomach tubing them if they have difficulty swallowing because of the facial paralysis. And for animals that go down, that become recumbent, intensive nursing care is vital. Turning them regularly to prevent pressure sores, keeping them clean, perhaps lubricating their eyes if they can't blink properly. This supportive care directly combats those debilitating neurological effects and gives the animal and the antibiotics the best chance.
Makes sense. So putting it all together, what's the overall prognosis for an animal diagnosed with listeriosis?
It really depends on how early that treatment starts. Without early intervention, mortality is high, often exceeding 70% for the neurological form. With prompt, aggressive treatment, including good supportive care, cattle can have a recovery rate of maybe around 50%. So it's still a toss-up. However, and this is a really sobering thought, even among the animals that do recover, permanent central nervous system injury is a frequent long-term consequence. They might never be quite right again.
So recovery doesn't always mean full recovery.
Unfortunately, no. And the prognosis gets significantly worse if the animal becomes recumbent, goes down and can't get up, or if it becomes very agitated or loses the ability to even sit up. This really highlights that the extent of the damage already done to the brainstem by the time treatment starts is the primary factor determining the ultimate outcome.
Wow. Okay, given how serious this is and the challenges in treatment, prevention seems absolutely key. How can farmers build their defenses against listeriosis? What are the main strategies?
You hit the nail on the head. Prevention is paramount. And the absolute cornerstone, the foundation of preventing bovine listeriosis, is optimizing how you make and manage silage.
Back to the silage again.
It's essential. You want to minimize contamination with soil or feces during harvest. So things like not cutting the forage too low to the ground, maybe avoiding harvesting in really wet, muddy conditions. Then it's vital to promote good, rapid fermentation. The goal is to get that pH down quickly to a low level, ideally below 4.5. Remember, Listeria thrives above pH 4.0, or certainly in that 5.0–5.5 range if fermentation stalls. And critically, never feed silage that's obviously spoiled, moldy, or comes from punctured bales or the surface layers of pits or bunkers, especially those outer layers prone to air exposure and aerobic spoilage.
What about leftover silage?
Good point. Promptly removing uneaten silage from feed bunks is important too, so it doesn't sit there and potentially spoil further. Some farmers also use silage additives, which can help improve the fermentation process.
So for you listening, the big picture here seems to be that poorly managed silage basically rolls out the welcome mat for Listeria. It creates the ideal conditions for this ubiquitous environmental bacterium to multiply up to levels that can actually cause disease.
That's exactly right. And it explains why we typically see the disease peak in winter and early spring, when stored silage is the main forage.
What about beyond silage? What other biosecurity measures are important on the farm?
Yes, silage is key, but general farm biosecurity is also crucial. This includes routine cleaning and disinfection of buildings, equipment, and especially feed and water troughs. And remember, you need to physically remove the manure and organic matter. First, disinfectant doesn't work well on dirty surfaces. Rodent control is important too, as rodents can carry and shed the bacteria. Isolating sick animals immediately is standard practice. And proper disposal of potentially infectious materials, aborted fetuses, placentas, contaminated bedding is critical to prevent further spread.
And the asymptomatic carriers you mentioned?
Exactly. Because animals can shed the bacteria without being sick, a robust overall biosecurity program helps minimize the general level of environmental contamination. It helps break that fecal-oral cycle.
Yeah.
It acknowledges that Listeria is resilient and likely present, so you focus on reducing the load and limiting exposure pathways. It's like having really good hygiene rules for the entire farm operation, including managing movement of people, vehicles, etc.
And it sounds like keeping the final feed and water delivery points clean is also vital.
Absolutely essential. You must prevent soil and fecal contamination of feed and water sources right at the point where animals consume them. Ideally, feed animals from troughs or bunks, not directly off the ground. If you have to feed on the ground, change the feeding location regularly to avoid heavy buildup of contamination. Keep those feed and water troughs meticulously clean. And fencing off silage storage areas helps prevent damage to bales or pits, which lets air in and leads to spoilage.
So the key takeaway for you is that even if you start with good silage, it can get recontaminated right before the cow eats it. So that final hygiene step is crucial.
Spot on. Hygiene at the point of consumption is critical.
And finally, focusing on protecting the most vulnerable animals.
Yes, that's a smart, targeted approach. Specific advice is to absolutely avoid feeding any poor quality or suspect silage to pregnant animals. They are particularly susceptible to listerial abortion. Also, generally minimizing stress factors, things like overcrowding, poor ventilation, unsanitary conditions, helps bolster the animal's overall resilience. And some farms find routine testing of their silage for pH, and potential spoilage indicators can help identify risks proactively before problems arise.
So it's about managing risk, protecting those most susceptible, like pregnant cows.
Exactly. It's focusing resources where they can have the biggest protective impact.
Okay, let's pivot now. We've talked a lot about the impact on cattle, but let's broaden the view. How does this cow disease affect us? Let's talk zoonotic implications in public health.
Right. As we established early on, Listeria is zoonotic. It can be transmitted from animals to humans. The main way people get infected is by eating food contaminated with Listeria monocytogenes. Think things like unpasteurized milk, raw meat, certain ready-to-eat dairy products like soft cheeses, deli meats.
And can it get into milk even if the cow seems healthy?
Yes, that's an important detail. Listeria can be shed directly into the milk of infected animals even if they appear perfectly healthy, those asymptomatic carriers again. Other routes for human infection, though less common than food, include direct contact with infected animals, especially handling aborted fetuses or placentas without proper protection, like gloves. And even inhaling aerosols, say, in heavily contaminated environments, is a possible, though rarer route.
So if we think about the whole food system, it sounds like a really complex farm-to-fork risk chain.
It is precisely that. Contamination can start right there on the farm, soil, manure, water. It can then enter the food chain through raw products like milk or meat. And then Listeria's unique resilience kicks in. its ability to grow, albeit slowly, at refrigeration temperatures, and its knack for forming these sticky, hard-to-remove biofilms in food processing plants.
Biofilms, like a protective slime layer.
Exactly. Makes it very difficult to eliminate from processing environments once it gets established. All this means that control requires integrated food safety measures across the entire supply chain. It's not just a farm problem or just a processing problem, it's the whole continuum.
Now, human listeriosis, while thankfully rare compared to something like salmonella, often makes headlines because it can be so severe. High hospitalization rates, high mortality.
That's correct.
This raises a critical question for public health. Why is the impact, even if the number of cases is relatively small, so disproportionately severe in certain groups of people?
That really is the crux of the public health concern. Listeriosis preferentially and severely affects specific vulnerable populations. We're talking about people with weakened immune systems, maybe due to illness, medication like chemotherapy, or organ transplants. Pregnant women are another major group, and the elderly.
What happens in those vulnerable groups?
The outcomes can be very serious. Meningitis infection of the brain and spinal cord lining septicemia, which is that widespread blood infection. In pregnant women, it can tragically lead to spontaneous abortion, stillbirth, or severe infection in the newborn baby, a condition called granulomatosis infantiseptica. These severe outcomes are why public health agencies issue strong advice, especially for these vulnerable groups, to avoid high-risk foods. Unpasteurized milk and dairy products, soft cheeses made with unpasteurized milk, deli meats, pâtés, smoked seafood, unless heated thoroughly.
So the severity in these groups drives a lot of the concern and the preventative advice.
Absolutely. There can be milder forms, like skin irritation from direct contact during, say, assisting with animal birth, but it's the severe invasive disease that's the major worry.
And thinking about food safety and how contamination happens, it sounds like Listeria is a uniquely challenging bug for the food industry to handle.
It really is one of the toughest,
Right.
primarily because it grows at refrigeration temperatures. Most other foodborne bacteria either stop growing or grow extremely slowly in the cold, but Listeria keeps multiplying. And that biofilm formation we mentioned allows Listeria to persist in cracks and crevices in processing equipment, drains, coolers, making it incredibly hard to completely eliminate through normal cleaning and sanitation.
So contamination can happen almost anywhere along the line.
Pretty much. It can happen at the farm level, contaminated soil, water, manure, getting onto raw products, maybe poor worker hygiene. It can happen in processing facilities, cross-contamination between raw and ready-to-eat products, maybe inadequate temperature control, insufficient cleaning and sanitation, allowing biofilms to form. And it can even happen during distribution or at retail or even in the home if temperatures aren't maintained properly or there's poor sanitation.
So what this means for you and for the food industry is that you need incredibly stringent sanitation protocols. Continuous environmental monitoring, swabbing surfaces to look for Listeria becomes essential. And they're even looking at novel interventions, right, like using bacteriophages.
Yes, exactly. Bacteriophages are viruses that specifically attack bacteria. There are now FDA-approved phage solutions that can be sprayed on ready-to-eat meats or in processing environments specifically to target and kill Listeria. It's an ongoing battle requiring multiple layers of control, extending way beyond just controlling it on the farm.
Beyond the devastating health impacts, let's talk dollars and cents. What's the economic fallout from listeriosis, both on the farm and beyond?
The economic impact is substantial on multiple levels. On the farm itself, you've got the direct costs of animal deaths. Then there's reduced productivity. Maybe a cow survives the neurological form but has permanent damage and doesn't produce as much milk or gain weight as efficiently. And those reproductive losses, abortions, stillbirths, needing to cull cows that can't reproduce, those are huge economic drains. These cumulative hidden costs can really hit a farm's bottom line hard.
And the impact ripples outwards from the farm, doesn't it?
Oh, massively. The broader industry and public health costs are enormous. In the U.S., Listeria monocytogenes is considered one of the most economically impactful foodborne pathogens. The total annual costs are estimated to be in the range of hundreds of millions, possibly even billions of dollars when you factor in medical expenses for treating human illness, lost productivity due to sickness or premature death, and the cost associated with fatality.
And product recalls must be a huge factor, too.
A massive cost driver. When a food product is linked to a listeriosis outbreak, the resulting recall can cost a company millions, sometimes hundreds of millions of dollars. There was one famous outbreak linked to deli meat that reportedly cost the company over $200 million, including a $76 million recall cost alone. Plus, the damage to brand reputation can be immense and long-lasting.
So the bigger picture for you listening is that investing in prevention, both at the farm level with things like good silage management and biosecurity, and robust food safety protocols throughout the chain, it's not just about health, it's a societal benefit.
Hmm.
It helps mitigate these massive downstream economic costs across the entire food system.
Absolutely. Prevention pays off economically and in terms of public health.
Okay, as we wrap up this deep dive, it's really clear that bovine listeriosis, while maybe sounding specific, is actually a really significant and complex challenge. Strongly linked to silage management, yes, but there's so much more to it.
Definitely. And despite all the advancements in understanding it, lingering challenges absolutely persist. We've talked about Listeria's incredible resilience in the environment, the problem of asymptomatic carriers shedding it silently, that frustratingly long and variable incubation period making traceback hard, and its tricky intracellular nature that limits how well antibiotics work once infection is established.
So, what's the path forward? Given these challenges, what does the future look like for controlling this multifaceted threat?
It really has to be a multifaceted, integrated approach. We need enhanced surveillance systems, systems that can better connect the dots between cases in humans, findings in food samples, and isolates from animals and the farm environment, getting a clearer picture of the epidemiology. We also need continued research into novel interventions. Things like those anti-Listeria phage treatments for feed or food, maybe better silage inoculants that more reliably suppress Listeria growth, and improved diagnostics would be a huge help. Developing faster, more affordable, maybe even on-farm diagnostic tools for earlier detection in animals or feed could make a big difference.
And bringing it all together on the farm.
Integrated biosecurity programs are key, taking a really holistic view of the farm environment to identify and try to eliminate reservoirs where Listeria might persist, coupled with continuous training for farm personnel so everyone understands the risks and prevention strategies. And what's truly fascinating, and I think the real way forward, is fully embracing that One Health perspective.
One health, the idea that animal health, human health, and environmental health are all interconnected.
Exactly. Recognizing that intrinsic interconnectedness is absolutely fundamental if we're going to effectively control zoonotic pathogens like Listeria that exist at the interface of all three. You can't tackle it in silos.
So, as a final thought for you to take away from this deep dive, consider how this seemingly niche cattle disease, listeriosis, actually reveals these profound connections. Connections between our food systems, the health of our environment, and ultimately our own health and well-being. Think about those hidden challenges we uncovered, things like the invisible asymptomatic carriers or those devastating silent abortions that don't show obvious signs in the mother. What do challenges like that mean for how we approach food safety, animal welfare, and even environmental management? This whole exploration for me really underscores the power and the necessity of that One Health approach you just mentioned. It shows just how linked everything really is.